Is the VA really redirecting its resources to provide healthcare to illegal immigrants at the expense of our veterans? This is a question that has sparked debate and controversy, with misinformation clouding the true state of affairs. The claim, widely circulated and often heatedly debated, suggests that the VA is using its resources, meant for U.S. veterans, to fund healthcare for illegal immigrants. A deeper dive into the operational mechanisms of the VA, Immigration and Customs Enforcement, or ICE, and the healthcare processing systems, however, tells a different story. The confusion seems to stem from the involvement of the VA's Financial Service Center, or VA-FSC. This department has been contracted by ICE since 2002 to process healthcare claims. But it's important to note that while the VA-FSC processes these claims, it does not fund them. The bills are footed by ICE, which reimburses healthcare providers at Medicare rates through the VA-FSC using taxpayer money allocated to ICE, not funds from the VA. Senator John Tester, the chairman of the Senate VA Committee, has stated in no uncertain terms that VA does not provide healthcare to illegal immigrants. The VA's role is limited to administrative processing, not providing care. But what about the potential effect on VA resources? This is another area where misconceptions abound. The VA has clarified that the use of its financial services by ICE does not impact the VA's budget or the resources allocated for veterans' care. The processing agreement costs the VA nothing, as ICE bears the expenses for the services rendered by healthcare providers. Different media outlets, depending on their political leanings, have painted this situation with different brushes, often leading to public confusion. For example, conservative outlets may emphasize the use of VA resources in the care of illegal immigrants, without making it clear that these resources are strictly for processing payments, not providing care. On the other hand, more centrist or left-leaning sources might focus on the fact that this arrangement has no impact on VA resources and has been in place for over 2 decades, aiming to dispel concerns about the misallocation of funds meant for veterans. So, the narrative that the VA is diverting care from veterans to serve illegal immigrants is factually incorrect. This misunderstanding is the result of a lack of clarity about the role of the VA-FSC and the financial flow managed by ICE. The VA remains committed to serving U.S. veterans exclusively, with ICE independently funding its healthcare responsibilities through a separate budget. It is crucial for discussions and criticisms to be based on a comprehensive understanding of these administrative roles. Misinformation only leads to misplaced blame and unnecessary confusion. By critically evaluating the sources and understanding the operational details, it becomes evident that the care and resources dedicated to U.S. veterans by the VA are not compromised by the administrative support provided to ICE. This clear delineation helps maintain focus on the factual operations and safeguards against misinformation. Remember to like and subscribe.